Welcome in.
Hi, I'm Shakita. I'll be your nurse today. Today I'll be performing your head-to-toe assessment. You have the right to refuse, so if you're okay with me performing it,
Yes.
okay, so we'll proceed, okay? I'm going to close the curtains for your privacy, and I'm going to wash my hands. All right, so I'll just start off with looking at your face, okay? And everything looks symmetrical. I don't see nothing out of the ordinary, okay? All right, so now I will palpate your scalp, and you just tell me if you feel anything, any pain. I don't feel any nodules, okay? All right, and then I'll palpate your arteries, your temporal arteries. All right, and then here I'm just going to check your TMJ joints, okay? So I'm going to have you to clench your teeth, try to open. All right, close your mouth. All right, good job. All right, and then this is your central nervous 5, CN5, yeah. So here I'll have you to clench your teeth together. All right, and then try to open your mouth. All right, close them. All right, and then I'm going to take this cotton ball and I'm gonna have you close your eyes, and you just tell me when you feel it to your ear, okay?
Feel it.
Okay. What about that?
Feel it.
All right, and then now I'll check your central nervous 7. So here I'll just have you to smile for me. Frown. I'll have you to lift your eyebrows, close your eyes tight, lift your eyebrows. All right, and then I have you to show me your teeth, puff out your cheeks. All right, good job. All right, and then now we're going to check your eyes, your vision. Okay, so I just have you to stand about right here. Okay, and do you wear any type of glasses or contact lenses?
Yes. Contacts.
Do you have them?
Yes.
All right. All right, and just looking at the smallest line here, I'll have you to close one eye with your hand, and just tell me on the smallest line that you can read.
L E F O D P C T.
All right, and can you do the other side for me?
L E F O D P C T.
Perfect. And just reading those lines, it say that you would have 20/15 vision. And now I just take your 6 field cardinal gaze, okay? And here, you're not going to turn your head. You're just going to follow my hands with your eyes, okay? All right, good job. All right, and here, I'm just going to check your eyes, okay? So, I'm going to shine this bright light in your eyes, okay? And you are about a 3. And then, everything is symmetrical. Your sclera is white. Iris is brown. Regularity, okay? Good job. And then, I'll check your ears, okay? And I'm just going to check your external ears. I don't see abnormal drainage or anything. And do you feel any pain?
No.
Okay. Then I do the other side. Any pain?
No.
All right. And here, I'm just going to perform a whisper test. I'm just going to say a word, and you just tell me what you hear, okay?
Butterfly.
Okay. And here?
Station wagon.
Okay. All right. And I'm just going to check your nose. All right. And do you feel any pain in your nose? All right. Could you occlude one nostril for me and sniff? Okay. And what about the other side? All right. Good job. And now I'm just going to check your sinuses, okay? So your frontal, do you feel any pain or pressure here? Okay, what about here? Okay, good job. And now I'm just going to look inside your mouth, okay? Just make sure everything is intact. So I see your teeth are intact, tongue, mucous membrane is pink and moist, your palate is good, gums, no open wounds, abnormal drainages. All right, good job. All right, and could you stick out your tongue for me? And I'm just gonna push against resistance. All right, all right. And would you say "ah" for me?
Ah.
All right, and I'm just gonna check your reflex, your gag reflex. Okay, good job. And your uvula did rise. Okay. All right. Huh? Oh. Now I'm just gonna check your lip nodes. Okay. So I'm gonna start off with your occipital. post-auricular, pre-auricular, submandibular, submental, tonsil, deep cervical chain, supraclavicular, and superficial cervical. All right, and there I didn't feel anything. They're spongy like they're supposed to. Only probably you can feel them real good if it was you had infection in your body, okay? Which sure you don't. All right, now we'll do your CN11 range of motions. Here I'm just gonna have you to tuck your chin to your chest. Okay. All right. And can you just turn your head from side to side? All right. And what about extending your head backwards? All right. Until you touch your ear to each shoulder. All right. And then could you shrug your shoulder? All right. Go up some. All right. Good job. And now I'm going to check your thyroid and your trachea, okay? All right. Which I will have you to, you're going to take a drink of water. And I have your hand back. Okay, take a drink of water for me. And I did feel it rise. Good job. All right. And now I'll put this up. And then here I'm going to palpate your carotid arteries, your carotid pulse on one side of each. And then I'm just going to listen with the bell of my stethoscope, okay? Sorry. And I'm just listening for any thrills, okay? Which we don't want. And now, I'm just going to check your posterior chest, which is your back. And I'm going to look. I don't see anything out of the ordinary. All right, and I'm going to palpate, just touch, okay? Any pain? Nothing. I don't feel any nodules. Okay. Okay, and then I'm going to have you to repeat the number 99, okay? 99. Good. And here, I'm just gonna listen to your breath sounds. Alright, and then I'm just going to check your flanks for any pain, okay? And just let me know if you feel any pain or tenderness. Feel anything? Alright, what about here? Alright, and I don't know if I checked with the percussion, so I'm just going to and I'm just trying to hear if it's throwing this all the way around. Now I'm going to check your upper extremities, okay? And I see nothing out of the ordinary. Your skin tone looks good, all right? And then I'm just going to palpate them. Do you feel any pain here? Okay, no pain. All right, then now just check your pulses, your brachial pulse. Your radial. And your ulnar. Good, and they're equal. All right, and then here I check for your capillary refill, and they are less than 2 in that hand. Okay, and they're less than 2 in that hand as well. All right, and now here we will do the range of motion to your shoulder, okay? So I'm just going to have you to raise your hand above your head. All right, And can you stand to the back? All right. And could you send them out to your side? And just drop them for me. Good job. And now we'll do the range of motion to your wrist, okay? So we'll just, yep, and then pull them up. All right, and pull them down. All right, and here we will do your turn on them. All right, flare them out, making a fist. All right, and then I'm going to have you to touch every finger to your thumb. Okay, and open them and close them. All right, good job. And then now we would just do the range of motion to your elbows, okay? And hold them up, push them, and pull them. All right, good job. And then you're just gonna turn them. Okay, good job. And now we will do the cerebellar function test. So you will extend your hands out, and you will take one finger, touch your nose, and then the other one, and then go a little faster for me. Good job. All right, and then now we will do a rhapsthesia test. And here is where I will draw something in your hand, and you will just have to tell me what you think I drew, okay? Close your eyes.
7.
And here.
3.
Good job. That's it. And then now, your stenosis test. I will do the same thing, except for this time I will place an object in each of your hand, and you just tell me what it is. Close your eyes for me.
Key.
Okay. What's that?
Quarter.
Okay. Good job. And now I'm just going to test your reflexes, okay? So here I'm going to test your tricep, your bicep, and your brachial, okay? I need you to hold this real loose, okay? And I'm going to, good job. And then here, just hold it real loose. And here. Good job. And then I'm going to do the same thing here. Hold it real loose. And then hold it real loose. And hold it real loose. Yep. All right. Good job. And then here, I'm going to have you to lay down on the bed. Okay. And I'm going to look. I'm just looking at your chest. And I'm just watching your work of breathing. Doesn't look like you're having difficulty breathing. And I'm feeling for heaves and thrills, okay? And then now I'm going to listen to your heart's sounds. And I will listen 2 times with your heart sounds. I will listen with my diaphragm first, and then I listen again with my belly, okay? Okay, and then I listen again with this side. And here I'm listening for any murmurs, okay? And I didn't hear anything, which is good. Okay. Now I'm going to go to your abdomen. And we look, listen, percuss, and palpate, okay? So I'm just looking. I don't see anything out of the ordinary, nothing distended. Skin color is good. And now I'm going to listen in all 4 quads. And I'm just listening to your bowel sounds, okay? You sure have bowel sounds. And while I'm at it, I'm just going to listen to your aorta and your renal arteries, okay? And I didn't hear anything, which is good. All right, now I'm just going to percuss, okay? And then I'll do a light palpation. Then I'll do a deep, okay? Any pain? And then I'm gonna palpate your liver, okay? Okay, take a deep breath. Let it out. Okay, any pain there? All right, good job. All right, now I'm gonna move down to your legs, okay? So now it's just the same thing. I'm gonna look. And your legs look good. Skin color looks good. Palpate. Any pain? Okay. Okay. And then I'm going to go into checking your popliteal pulses and posterior tibia. Dorsalis pedis. Okay. And then just going to check for edema, which I don't see any edema. That looks good. All right. And then now I'm just going to have you to do some range of motion with your hip, okay? So I'm going to have you to turn your feet inward and turn them out, okay? And then I'm going to have you to raise one 90 degrees, and raise the other one 90 degrees, okay? And then now I'm going to have you to bend one leg to your chest and bend the other one to your chest. Good job. Now I'm just going to have you to kind of plant your feet, plant your toes, and then pull them back. All right. And then I'm going to have you to invert them. Okay. Pull back. Okay. And push down. All right. And turn your toes in and turn them out. Okay. Good job. All right. And now I'll check your reflexes. So I'm going to do your Babinski reflexes while you're laying down. It's just easier to do. And here, it's going to feel weird. I'm going to run something up the bottom of your feet, okay? And what we're looking for is we don't want them to flare out. We kind of want your toes to go down, okay? Okay? Do it feel weird? Okay. Here. Okay. All right. Now you can sit on the side of the bed. Okay. And this is just your popliteal. I'm going to check the reflexes here. You did good. Oh, sorry. And here. Yeah. Okay, and then here. Okay. And okay. All right. And then I'm just going to have you, since you're sitting there, I'm just going to have you take one heel and just rub it down your shin. And do the other one. Good job, good job, good job. So now I'm gonna get you to stand up. And I'm gonna get you to walk from here to there on your toes.
On my toes?
On your heels. I'm sorry, on your heels. Okay, and walk back on your toes. Good job. All right. And now we're gonna just have you to stand up. And this is called the Rumberg test. And you're just gonna close your eyes. And I'm just gonna watch your posture, okay? And a little swaying is fine. That's good, okay. And then I'll get you to hop on one leg. And the other. All right, good job. And now I'm just gonna check your spine. I'm gonna have you to bend over, touch your toes. Turn the other way. Yeah. All right, and I look, and then I don't see anything out of the ordinary. I feel, Alright, good. I don't see anything. Alright, stand up for me. And this time I'm going to have you bend from side to side. And try to bend backwards like this. Alright, and you're going to twist your shoulders. And that's it. Thank you. Okay, so now I'll go into my patient teaching, okay? And I chose hypertension for the simple fact that you have it that runs on both sides of your family. And I want you to know what it looks like, what it feels like, just in case, ways to manage it, ways to prevent it from coming on. Alright, and so I got you one. And so basically hypertension is high blood pressure. And this is where the blood gets too high in your veins. And that's what causes a high reading of blood pressure. What things that you need to know that I feel that is important, your risk factors, which genetics, like I said, it runs on both sides of the family, so this is why I pulled it for you. Your age. As you get older, you have a higher risk of becoming a candidate for high blood pressure. Being overweight or obese, just being a couch potato, not wanting to exercise, a diet high in sodium. So you want to watch those foods that you intake, and drinking a lot of alcohol. So warning signs for hypertension, headaches, and I'm not just saying like little headaches what you get, but these you're gonna know the difference from a hypertension headache to just a real over migraine. Okay, you might get blurred vision with those headaches. You might get nosebleeds and chest pains. Okay, if you would turn to the next page. So things that can happen just because you have high blood pressure. Heart damage. High blood pressure can make arteries less elastic, which reduces blood flow to the heart. So this can lead to heart diseases, heart attacks, heart failure, and other heart conditions. You can have a stroke. High blood pressure can cause your arteries to burst or become blocked, which can lead to a stroke. Kidney damage. High blood pressure can damage the kidneys, which can lead to kidney failure. And these are a lot of things that is very serious, so we kind of want to try to prevent it, head on. Vascular dementia. High blood pressure can contribute to blockage of small blood vessels in the brain. And you can also have an aneurysm. High blood pressure, constantly high blood pressure readings can cause your arteries and your vessels in your brain to become weak and they burst. You don't want that. So how can we treat this? How do we know that you have a high reading when you take your blood pressure? So it's different stages of blood pressure. It just depends on what stage you are. So we all know that a normal blood pressure runs from 120 to 180, which is going to be your top number, which would be 120, your bottom number, which would be 80. Then once it starts becoming elevated, that top number will range from 120 to 190, 129, and the bottom number is below but not above 80. And then it becomes stage 1 hypertension. The top number ranges from 130 to 139. Bottom number will stay between 80 and 89. So you see how as you go it gets higher and higher. And then you have stage 2 hypertension, which is the worst one. Your top number will be around 140 or higher, and your bottom number will be 90 or higher. And I've seen it to where it's 200 over 100 and something. So you want to watch that. Just say you become a patient with hypertension. Things that we would need to do would be to take your blood pressure medicine as prescribed. So when I say as prescribed, that means what does the bottle say? It might say take daily, which is 1 time. It might say take BID or 2 times a day, so forth and so forth. You want to take your medicine at the same time every day. So if you wake up, take your medicine in the morning, next day, wake up, do the same thing, Never double dose on your dose of medication. Even if you miss a dose, don't go back and say, hey, I missed this dose, so I'm going to take this dose and the next dose because they're due. No, you just pick up where you missed, and therefore, And then always keep a record of your blood pressure daily. We never know if the medication's working if you don't have a log. So we tell patients to go to the dollar store, get you a little journal, and just write daily. Put your date and your blood pressure, And then always follow up with your doctor if you have any questions. They're happy to answer any question that you need answered. So how can you prevent high blood pressure? So remember, beginning we talked about things that can cause it. Well, we just want to do the opposite. Eating a healthy diet, diet that's low in sodium. We want to limit our alcohol intake. We want to be physical, like get up and exercise. Whether it's 30 minutes a day, just do something, kind of walking. Stop smoking.